Joe, I would make a motion to approve the minutes for the regular meeting held on March 22nd, 2021 as presented.
Second.
Okay, motion from Dave, seconded by Rick to approve the minutes from our previous meeting. Questions on the minutes? I hear none. All in favor of approval signify by saying aye.
Aye.
And opposed? The minutes are good. Vouchers come next. Here again, those are included in board docs.
I did amend
I
that.
see we have a recent update, so it includes some things that probably weren't in the first version.
I'll make a motion. I'll make a motion to approve general checking account vouchers totaling $978,160.92 as presented.
I'll second that.
Okay, motion from Mike, seconded by Rick to approve our vouchers for the month. Any questions on the vouchers? And I see none. All of those in favor of approval of the vouchers as presented signify by saying aye.
Aye.
And opposed? The vouchers are approved. Public comment is next. I'm not aware of anyone that signed up. Anyone in the crowd yanks their hand up? We can entertain that. Don't see any, so we will move on. Item 2 is superintendent update. Mr. Donovan, letter A is update on our Milton Forward plan.
I have a couple things that I want to share on our Milton Forward plan. Give an update, the latest update on the positive COVID cases from Rock County. This is as of last Thursday, April 8th. We continue to have our weekly meetings with the Rock County superintendents and the Rock County Public Health Department. There has been across the county and across our district a slight uptick in the number of positive cases over the past 2 weeks. Currently, there are across the county, there are 8 hospitalizations for COVID as of last Thursday, and they continue to roll out vaccines at a pretty rapid pace. Again, as of last Thursday, were 50,000 people who had received their first dose of the vaccine, and 32,000 people who are fully vaccinated. And then I also wanted to update on our COVID dashboard, which we compiled. Was quarantined due to an in-school exposure, and one that was quarantined due to an outside of school exposure, but no active cases. The student numbers, we have seen an uptick from the month or so previous to that. Again, as of last Thursday, we had a total of 13 active cases from our students. That's kindergarten through 12th grade students. We have 58 students who are quarantined due to in-school exposures and 35 students who are quarantined due to outside of school exposures. The other thing from the superintendent's update that I wanted to share was I'm going to ask Tara Huber and Chris Tukendorf to come to the microphone, and they're going to share some information with the board and community about contact tracing. We haven't talked a lot about the process that we go through for contact tracing, and I wanted to make sure that we were aware of what that looks like. So Tara, do you want to go ahead?
Yeah, so just wanted to give you a little window into what happens when we hear about a positive COVID case at high school. So, or not every school, but the high school where I do them. So positive persons identified, either the county lets us know or parent calls in before the county lets us know.
Thanks. I guess. All right. So a positive person is identified, either the county or a parent. Sometimes, because our students are pretty responsible, they will send an email to a teacher before we even know the news, just to let them know. So we get a variety of ways of getting the information. We do a contact tracing phone call. Most of the time that's done by our district nurse, Brittany Coots, but she has given us some basic questions that we want to ask all students. And usually that's done with the parent and the student on the phone. So we talk about the different times that they would have been within 6 feet for more than 15 minutes. Masks or no masks is the guidelines that we go by from Rock County. Generally, we talk to them about before school, after school, throughout lunch, outside of school, if you were stayed overnight at a student's house, that kind of thing. Anything that would affect anyone that is in our school system, we're asking them about. We go over the timeline with them. So if they test positive, it is 10 days from their symptom onset or the test. So if they didn't have symptoms, then it's from their swab date is what we say. So that 10 days goes into effect. And we also ask them about the bus. Lots of our kids ride, but then that also includes riding together with other students. So we have to check on that. Then we contact all of their teachers and go through seating charts. Before we were all back in person as a choice, that was pretty typical to not have too many close contacts. We were keeping kids 6 feet apart pretty easily. This past week, we saw a little uptick in that because some classrooms are 3 to 5 feet with some desks. One that I did today was pretty good. The classrooms that individual was in was able to maintain 6 feet, so we didn't see that many close contacts today with that one. But then we have questions about like what activities did they do in their classes? You know, can you think back to, sometimes it's 4 days ago. Can you think back to what you did 4 days ago with your second hour class and this individual? So sometimes it takes a little while to like regain your bearings, and especially last week coming in, it was like their first day of school again on Monday. So we had a lot of questions last week to ask our teachers, and that was a process going through those. But I think now we have, seating charts are going to be best friends of ours, and making sure we remember back days ago so that we can do this contact tracing if needed. Then we contact coaches and contact trace practices and events. We gather a list of activities that the student is in, like FFA is meeting tonight, and there's so many things that are happening now, show choir, lots of different ones that we have to think about and make sure that we trace those and gather that list of activities so that then not only tracing them, but if they didn't meet, then it's letting them know that their students are quarantined and what the timeline is, that kind of thing. We send out a letter to all of our families if we have a positive case that was at school while they were contagious. And we look into siblings at other schools. So often, sometimes we forget that there's usually a sibling or something at another school that we need to let that school know about, and those timelines are different. So going through with the family why they're different and what they are. And then we track all the information, which I'll kind of get to at the end. We also send a list of close contacts to the county so that they are, if they have time, able to follow up on that, and they keep track of that. We have had to date 113 positive students this school year. And then as we go through with our positive person, if they were at school when they were during their contagion period, then we go through the close contacts. And when we identify close contacts that are in school close contacts, those are 14 days quarantine from the date of exposure. And so we live by the best recommendation of Rock County, where we quarantine for 14 days, whether they have a negative test or not. So that's from that exposure date. We identify those students and staff, get those students and isolate them in a room that we have here. We check on recent positives. So if a student is 90 days within if they were positive at one point and within that 90 days, they don't have to quarantine. So we check through that list of our positives. And then we also, when we call parents, we don't ask about vaccinations, but we do mention that if your child were to be vaccinated and they were 2 weeks after that, we would want to know that because they wouldn't have to quarantine then either. We are probably within the next month or month and a half going to see near the end of the school year, probably quite a few of our students who will be at that point. We're not quite there yet. We only have a couple. We mark their quarantine, and also for the positive individual, we mark their quarantine in Skyward in 2 different spots. One so that the teacher can see it, and then one that changes their method of instruction. So we keep track of whether they're virtual or not, and how many days throughout the school year they're virtual, so that at the end of the year, Skyward can tell us kind of who learned during what period of time, when, and how many students. So that'll be fascinating data. Close contacts at school, each parent gets an individual letter with the dates on it, because I know when I call people, I probably talk really fast, and it's a phone call that's a little bit shocking. And so they each get a letter with all the dates and the information on it, so that they can, if they need to follow up with me, they can. Many of them do give a phone call back. And then for those students, we also need to follow up with sports, activities, co-curricular, and inform all of those. When we're talking to close contacts, we never identify the positive individual. So sometimes that's hard for students, especially like racking their brain, where would I have come into contact? But it's sometimes a hard conversation because we can't identify who that is and how that happened. So trying to keep that confidentiality while still answering questions is a tricky balance. We also keep several different spreadsheets this school year. We found out pretty early on that we needed to keep track in a different way than just me scratching notes down. So we came up with some spreadsheets. We have a COVID quarantines tab on a spreadsheet. Those are students with symptoms. One of the main symptoms or 2 or more of the COVID symptoms, they have to stay out or get tested. We have probably 20 different questions that we ask, like date symptoms started, activity, like all the things that we would need to know if they do end up testing positive. And then if they have a close contact outside of school, that's the spreadsheet that we also keep track of. If a sibling or a parent has tested positive, or they have a close contact somewhere outside of school, whether it's one of our students or not. Then we have another tab for close contacts at school, another tab for positive active cases, and then we keep an illness tab because believe it or not, there still are some illnesses that are not COVID this year, but we keep track of that so that if they do turn to symptoms of COVID, then it's easy to slide over to that spot. And also just to track for your normal flu, sinus infections, all those kinds of things that we keep track of. So that's the scheme on students.
And I will speak to the staff side of it, and I'll try not to duplicate what Tara has said. But in an effort to track close contacts for staff, and when they became infected with COVID, a spreadsheet was created in August of 2020 through December of 2020. A new spreadsheet was then created January 1st of 21 to present. Some of the items that we track are the name, the building, close contact date. A new item that we track is if the individual is vaccinated, and if so, what was their second dose date? And if and when COVID symptoms start, test of COVID, the type of COVID test the employee received, and if there's any follow-up tests from the traditional COVID test versus a rapid COVID test. Date the employee's quarantine period started and the date the quarantine end. If Rock County shared any instructions with the employee about their positive case. And lastly, the employee time off for that quarantine period. We enter that in from the human resources standpoint. The supervisor and the district nurse contract trace for every positive case, and if close contact is confirmed, quarantine timelines are established and employees are notified. During this notification process, staff receive those COVID quarantine guidelines. If a staff member has been considered a close contact, HR will ask the employee if they have been vaccinated or not. And if the staff member chooses not to answer, that's fine. Then we treat them as if they have not been vaccinated. If a staff member has received both vaccination doses and 2 weeks have passed since their second dose, the staff member's COVID-19 close contact tracing does not require them to quarantine for 2 weeks if they were a close contact. However, the HR department continues to work closely with the employee, their supervisor, and the district nurse, and continues to track that close contact period in the event that symptoms develop. If a staff member is not vaccinated, they will need to quarantine for either 10 days if they test positive for COVID, or 14 if they are considered a close contact to a positive individual. Effective January 1st of 2021 through March 31st of 21, the district provided up to 80 hours of emergency paid sick leave to staff for the following circumstances. The individual is subjected to a federal government CDC quarantine or isolation order. The individual has been advised by a healthcare provider to self-quarantine, or the individual is experiencing symptoms of COVID-19 and is seeking medical diagnosis. So that has sunsetted on March 31st. And a few data points. From August 20 through December of 20, we had 259 employees quarantined due to close contact or testing positive. From January of 2021 till now, till today, we have 43 employees quarantined due to close contact or testing positive. Any questions for Tara or me about students or staff contract tracing?
Tara, I just had one question. You had mentioned, I think, 112 positive cases, something like that.
At the high school.
Okay, that's what I was
Yeah.
wondering. Okay.
Yeah, that's probably, well, it is our smallest number of the spreadsheets that we keep. Obviously, there's been more close contacts than
Right.
positives.
I have a couple comments and then a couple questions. First of all, I think all of us need to applaud all of the administrators and teachers and so forth. I think you just got a little glimpse into how complex that issue has been for our staff since August. And that's on top of everything academic and virtual, et cetera, that we asked of them. So please accept our thanks, and that is just an enormous undertaking. And I'm really, really proud of how we've handled that part of it. Secondly, I shared this with Rich. Some of you might know that once in a while people reach out to Rich and or board members, and specifically the board president. I fielded a phone call from a parent, actually twice, prior to our decision to go back 5 days a week, saying, "Don't do it. You guys are crazy. This is going to blow up on you." And as luck would have it, that our student is a close contact. And I had an hour phone call if I told you so, which no problem. I can deal with that. So the questions I've got are relative to, anecdotally, I was asked and told that CDC has said that 3 feet is the safe zone to determine close contacts, et cetera. Yet Rock County is insistent on hanging with 6 feet. I'm just wondering. I don't know that it isn't. It's one of those things that's hard to sort out, and says, someone would say to me, "Well, if CDC says this, why is Rock County saying this?" And I don't have a good answer for that. So I wanted to raise that question. And then I want to know if, and I realize we're following Rock County guidelines, but I have trouble understanding why, in particular in a close contact situation, if you would achieve a negative COVID test, why we would still ask that person to quarantine, unless we don't have confidence in that test, would be the only thing that I could say. And I'm not sure who can respond. Maybe nobody needs to, but just something that's been kind of eating me for a little while. I wanted to get it out there.
It's only negative for
Yeah.
the date when that test is done.
Mhm.
I can share a little bit on that. Yeah, I can share a little bit on that. Rock County does look at the Rock County Public Health Department looks at any recommendations that come out of the CDC and determine whether those recommendations fit based on the severity of the spread and the I know for a while, Rock County they recommend continuing the 6 feet of physical distancing and using the 6 feet of physical distancing for the contact tracing. And I just want to reinforce, I know that Shelley started to answer, and I was going down the same path, that there are cases where individuals will test negative on a certain day, but then begin to show symptoms a day later. That incubation time and rate for the virus varies from individual to individual. So someone could test negative and come down with symptoms or begin becoming contagious at a later date. So we've taken an approach to balance that importance of having students in school as much as possible, but also limiting the spread and doing what we can to limit the risk to the health and safety of our students and staff. And that model has worked really well for us so far. And I think going through the rest of this school year with that model in place is a wise move for us.
Yeah, we've talked about that as a COVID crew, so we have about 6 people that meet weekly and talk. Brittany's on that team, and so is Carrie.
No, it's breaking. Sorry.
So we've talked about that a little bit, especially in the last week, because I will say the phone calls from as a high school person and that we've done this week are hard when homecoming is next week. I mean that, you're quarantining kids through the start of some normal activities that they're all looking forward to. I would say when Brittany and I talked about this earlier today, and we try and wrap our minds around all of it, the CDC says certain recommendations, but the best recommendation for schools is still the 6 feet. And that's what Rock County has chosen to go by to recommend to schools, and that's what we have always chosen to follow what they've recommended, so.
Okay, I'm good with that. I just needed to share. Are you through all you're needed to, Rich?
Yeah.
Okay, excellent. Then we will roll on. 3 is Policy Committee, Mr. Rick.
Thank you, Joe. Policy Committee met last week on Tuesday, the 6th. First on the agenda was the first reading of the Neola policy updates, which, as always, are in board docs. There were a couple new policies included in those. One of those was 143.2, which is board member information requests. This is put in place to kind of make sure that information requests that come from the board are done effectively and efficiently, and to ensure that all board members receive the same information from the administration. Another new one is 144.5, board member behavior and code of conduct. There's a lot of great information in this policy, and I would encourage all board members to read it if they have a chance. This is in place to make sure that all board during meetings. Using cell phones during a meeting can give the impression that one really isn't engaged in the meeting. So we just, people, we have our computers that we're using, but kind of want to use women using electronic devices to, accessing the agendas and all the information. So there were a couple others with large additions. 1260, which is the incapacity of the district administrator, and 145 regarding sexual and other forms of harassment. Does anyone have any questions or comments about those lists of first readings?
I do. So the one, as I was reading these, I did have a concern about 143.2, board member information requests. As I read it, oops, hold on.
There we go. Hopefully you can hear me now. So 143.2, board member information requests. As I read this, the one thing that concerns me is that it tends, my interpretation of it, tends to limit the amount of information that a board member may receive in order to do their duties. And that's kind of concerning. I think real concerning anytime an elected official has a policy placed on where their access to information is limited in any way. So obviously, for those that don't know, this is probably my last full board meeting, so I encourage the next board to really look at this and possibly make some modifications. One of the things that I'm really concerned about is the district administrator will discuss with the board president any request as deemed necessary. I'm not so sure that's something that should be in there simply because it doesn't give oversight to the process, and depending on different situations, that could also restrict important information that a board member may need. So that's just a comment. I would just add that the future boards should kind of look at this and consider it and understand that this may impact future boards. I wouldn't say this board, but future boards down the road. It may impact them and the access to their information that they're allowed to receive to do the community's work.
Rich, can you speak to that a little bit? I know we talked a little bit about that at the committee meeting.
Yeah, we did discuss that at the committee meeting. I did some follow-up with both Neola and with our legal counsel on that. As Rick mentioned earlier, that is a new policy, so it's not an update to an existing policy. It's also not a required policy. It is recommended by Neola, and it's also recommended by our legal counsel. And in general, it reinforces that board members have the same rights as any community member to make an open records request and to have access to any information that's covered under the open records laws. But there is some information that board members don't have a right to, that individual board members don't have a right to. There's confidential information, for example, employee medical records or student disciplinary records, that individual board members would not have a right to access those private records unless for some reason it is in their role as a board member. An example where it might be in their role